Good afternoon or good morning for those joining us from Americas. This is our last session of the day one of the 4th Digital Health Society Summit. And the title is Challenges and Opportunities of the Green Digital Twin Transition in Health and Care. I'm joined today by Ilias Iacovides, who is an advisor at the DG Connect at the European Commission. Ilias works on maximizing the benefits of green digital transformation in cooperation with several Commission services and external stakeholders. He has initiated the European Green Digital Coalition that works together with the European Parliament pilot project on science-based methods to estimate the net environmental impact of digital solutions and on guidelines for green digital transformation in different sectors. And I will have a short fireside chat with Ilias. I have a couple of questions to him, but just for a bit of context, why we decided to have this session at the Digital Health Society Summit. Well, the European Commission's idea of leveraging the potential of digital transformation for reaching the Green Deal objectives is reinforced by the new industrial strategy for Europe. And it states that the twin ecological and digital transitions will affect every part of our economy, society, and industry. So here we would like to explore how these digital health solutions must contribute to the European Green Deal and what more can be done to stimulate green growth through digitalization in healthcare. So welcome, Ilias. Thank you for joining me today for this discussion. So perhaps the very first question is if you can tell us a bit more about this green digital twin transition and how it links to the healthcare sector.
Right. So happy to be here. Healthcare, as you know, it's my life sector. So I spent the last 25 years before I moved to environment in digitizing healthcare. So before I tell you exactly what digital and healthcare have in common with respect to green, let me give you a larger pattern for you to understand. Once upon a time in the ministries, there were very specific sectors that had their own policies and regulation. Health, security, education, government, industry, and they lived happily until digital came. Digital came and just messed everything around. So since 70s, 80s, and really took off in 90s, digital came in as a transition and redefined many established rules and even power games and relationships of the stakeholders. And it's not always for the good. So there is this thing called digital transition that we experience. And if you have kids, you really experience it and you know what I mean. And we wonder, what is the digital transition aim? Because we know what is the Green Deal aim or what is the environmental aim. Sustainability aim is, to be sustainable. I don't know if you know about planetary boundaries, just to make sure that the environment and climate are all in check. We know where we want to go. We know where we want to go in education, or maybe it differs between different cultures. We know where we want to go with respect to security. We want to go to industry. But where are we going with digital transition? It lost a bit the original thinking, which, like any transition, it's about well-being. Digital transformation is about well-being. But if you just reflect a bit, do you still believe this is what's happening? Is digitalization that is happening today for well-being? And well-being with respect to human health, planetary health, industrial, competition. So there is a question mark, and that people start wonder, what is this? What is the impact of digitalization on all the sectors? So let's focus on environment. When I ask environmentalists, what is the impact of digital? You can ask also healthcare constituency at large, what they think about digitalization. And I went through it because there was a lot of skepticism in the 90s when I worked on it in 2000s. Most of the environmental fundamentalists think digital is just a pollution. It's not a solution. It's just a pollution because they see the impact of data centers, the e-waste, the mobile phones we throw away, the laptops, iPads, and all that stuff. And they say, okay, I have some data for me to understand the environmental problem, but overall, the impact of digital is about 4% of total emissions, which is much bigger than aviation. So the digital creates energy and material pollution, okay? So carbon and soil and sea and water pollution. That's how they see digital. Of course, then there are the solutionists that say, but digital will redesign everything, make it virtual, make it great, and we will be able to do. And the potential of digital is to actually avoid 15, maybe even more % of total emissions. So the potential is much bigger than the pollution, but the potential is not realized. It's a potential. And it's not realized for two reasons. One, because we don't have the guidance, the metrics to actually measure the avoidance, and we don't have the governance in place. And that is where it touches healthcare as well, because healthcare went through that as well. When e-health came around, it was the third industrial block. So we had the pharma industry, medical device industry, and e-health industry. It was a dwarf compared to the pharmaceuticals and medical device. As industry, it was minuscule, especially when I did it 20 years ago. But because there one big issue, and that was the metric and guidance and governance, because the other two industries were very regulated. You know what a randomized clinical trial was? You went to a conference, doctor talked to other doctors. I went through this metric called randomized clinical trial. Guys, let's give it to our patients. It works. Fine, perfect. When it was about e-health, it was always engineer waving his hands saying, guys, you're stupid. You're not using this decision support system or this hospital information system. Today is the AI system, and you don't understand. This will do good. No metric, no user talking to user. It was always engineers talking to doctors. And that is also happening in the environment sector now. So I'm trying to come back. And so I'm working on the metrics, governance, and all that. Now, specifically, what does it mean for healthcare? You in healthcare have already huge digital infrastructures. Those infrastructures can be improved with respect to energy and material efficiency. So this is a message to CIOs and CTOs. All the digital infrastructure in hospitals, regional networks, national networks can be improved with respect to what kind of equipment you buy, what kind of service agreements you do with the big ones, what kind of cloud you use, and what kind of, let's say, service and leasing models you apply. So you can virtualize a lot, except the sensitive information maybe, and you can do much better as infrastructure to minimize the footprint of digital operations of healthcare sector. But I don't want to stay too much on this one. If anybody's interested, we can go through what kind of rules we're applying for data centers, equipment buying, leasing of equipment, and all that. I would like to go more on what we can do through digital to be a greener sector as healthcare. And I have three major points.
Yes, I will just jump in here. This is exactly what also our audience is interested to hear. What more can be done to stimulate green growth through digitalization in healthcare? So,
yes, and there are pitfalls and challenges, and as well as opportunities. So what we can do using digital to be greener as a sector. First of all, healthcare is a huge opportunity in a way that you can you can be more circular sector. So you are buying a lot of equipment, you are procuring a lot of equipment. You are a huge sector as industry. And that industry, it's not circular. You use, in many of the medical instruments, you use rare earth materials, titaniums, and you name it. And so there's a lot of materials, very expensive and rare, that are not designed necessarily for reuse. There's a lot of single-use things. So there are many single-use medical devices that we could rethink in terms of redesign. So we can actually, because once it's a single use, it is thrown in a medical waste, all that has to be burned. There is a special treatment of medical waste. And many of the medical waste include even electronics in it, okay? But overall, except the circularity, using digital and data, you can actually track and trace your values that you're using, your materials, to make sure that you actually buy differently. There is something called green public procurement, that you can go and rethink what you buy, from textiles to medical equipment to huge equipment that you can put in to be more of a recycled, refurbished equipment. You can sign licenses to make sure that you actually have something used by service rather than materials. So if you want carpeting or, you know, linoleum or carpeting in hospitals, you can buy 10-year service to get it done rather than buying material, then throw it off. So there are smarter and more circular ways to do it. The other thing.
Sorry.
Yep.
No, and how do you see this happen in practice? Do you think that you know, the procurers should take this responsibility on their own, or should this be regulated? Should there be somehow get some advantages, some incentives to act this way?
Yes, at the moment we are working with the ministries of digitalization, and they promise, so we have some kind of commitments that they took on how to use green public procurement, procuring digital material. But I'm sure that you can copy and you can kind of rethink, what does it mean for healthcare sector? How, if I procure, what is that I can do to be greener in terms of not only energy efficiency, mostly material efficiency, because the biggest point that digital can do to green transition is to make our economy circular. Circular economy is the biggest thing you can do to prevent climate change. More than 50% of the emissions of industrial emissions are due to non-circularity of our economy. So, and people always are fascinated by burning oil and energy and electricity consumption. The real problem is the natural resource use, not the energy, because we will get there. At some point, we will get the renewables, you know, to be majority. Somehow on the energy, we know what we're doing. It's the expense. So everybody agendas align, except some companies that make money on this, on the situation today. But in materials, they are not valued. Nobody cares. Nobody measures the natural resource. Nobody taxes this. So there is no incentive to use less materials to do what I need to do. And there, digitalization can really help, because we need to actually track, trace, register, and reuse, remanufacture, recycle, refurbish, you call it. I mean, there are many, there are 10 R's. I'm not going to through all of them. And that's where digitalization helps, because it's what is waste? Waste is a value that lost its information. Waste is a value that lost its information. So digital can come in, reattach, and keep that value, that information with the waste. And that becomes, the piles of waste suddenly are very valuable if we know where and what is in it. And we can separate, we can, where it is, we can add it up and treat it differently, completely differently. So that's kind of the biggest message of Digital 4. But there's another one that I want to talk about. There's another two. One is behaviors. Healthcare is miles ahead in understanding the irrationality of human being. So what the environment sector wants to do to people, to tell them, go and take green journey, become greener as a citizen, they are 50 years ahead in healthcare, because they already tried for 50 years to make health journey to be something that people take. And I'm not talking only about tobacco and alcohol and substances. There is the whole, how to live healthier, and how the health sector can put a responsibility on the patients, is where we have so much wealth of information that the environment could benefit from. And that can be from data points, publications, tacit knowledge. There is a lot that I would like that healthcare actually re-engages with the environment. And they already have something in common for many, many years. So that's environmental health. The chemicals that are killing us, it's already environmental and healthcare common agenda. We can actually add other agendas, and that's the digital agenda, which again, healthcare maybe help, or vice versa, can get help from environment, and the human behavior agendas. Okay, and they're all driven by data and tools that we give to patients. So we, in my time, we were talking about patient kind of a guide. So patient compass for healthcare. We can do that citizens compass for green journey. What really matters for them to do, and what is kind of sidetrack or greenwashing. Mm-hmm. And the last is innovation. So that's maybe the most important for this Congress. That's innovation and startups. There are 25% of startups on our climate startups, but there is a huge startups on health. those agendas can be actually merged. And if you are green health innovation startup, this is the most sought after by investors. I shut up here and you can ask more.
No, thank you, Elias. You gave us a very strong message and also, like, I think a lot of food for thoughts and a lot of actions to be taken. But if you would suggest one thing from being like representing the European Commission to the, I don't know, hospital managers and medtech developers, what would be your one suggestion for a next step? Where should they look for the information? What should they do now after listening to you?
Locally, they should look who are the people working on circular economy. We are working on something, and it's not by chance because I worked 25 years in electronic health records. We are introducing the same type of concepts called digital product passport. So making my sector circular by tracking and tracing the materials. Yesterday it was digital patient record. So these principles of interoperability, how to make sure that we track and trace the patient and ensure continuity of care, those principles are being applied to industry. We call it digital product passport. But if you really look it up, this is basically inspired, I mean, I started it by the digital patient records. So I would like the hospitals to think how they can be more energy and efficient and material efficient, see how they can actually improve while not compromising on the quality of care. You can still do the quality of care and address needs with less material. So that's kind of the biggest impact on the environment, but also when it comes to behaviors and innovation. So the innovation that the green guidelines will put in will really stimulate innovation, because what is digitalization in all those sectors I said, healthcare, education, industry? It's kind of a Wild West until you put governance on it. You have to design, use, and govern it in a way so it has a positive impact. If you don't do that, you get both rebound effects, you get negative impacts that you don't really want to see. So if you're just thinking that I will throw digital at hospital or digital at environment or digital at whatever, sure, and you don't govern it, don't design it and use it with some metrics, normally I would bet you more than 50% you get more damage than good.
Thank you, Elias, for this, as I said, information, inspiration and food for thoughts. And also from our side at the ECH Alliance, you who are listening to us, you might have remembered that the Global Health Connector Partnership, we also launched the Green Health Team. And actually, we encourage the cross-sectoral coalition on making sure that, yeah, we are not greenwashed, but we choose greener, better digital solutions. So thank you, Elias, for being with us. This was a short and productive discussion, and I hope that yeah, people will follow this message. Thank you so much.
Thank you for having me. Bye.
And for everyone, we will take a short technical break for 30 seconds and come back for the closing session of day one with some key messages from me and my co-host Bladen Rees. So stay with us.